Hello, Mr. Bullens. My name's Kelly, and I'll be doing your assessment today. Mr. Bullens is a 24-year-old white male who appears well nourished and is appropriately dressed. He's well groomed and has no unusual body odors. He's awake, alert, and calm. No signs of acute distress are noted. And his blood pressure is 122/70 while sitting. Heart rate was 64 apically. Temperature is 98.1 degrees Fahrenheit orally. Respirations are 18. And his oxygen saturation is 98% on room air. Mr. Bullens is 6 foot 3 inches and weighs 210 pounds with a BMI of 27. Now, Mr. Bullens' hair is smooth in texture and is symmetrically distributed on the scalp and body areas with consistent color and hydration. No evidence of excessive hair breakage or loss is noted. The scalp has consistent pigmentation and no lesions are noted. The cranium is proportional to the body, symmetrical, atraumatic, and normocephalic. The facial features appear symmetrical, midline, and proportional. Mr. Bullens, please close your eyes tightly. Now open them fully. Very good. The extraocular structures open and close completely and symmetrically, with spontaneous blinking noted every 2 to 3 seconds. The eyebrows are brown and full with even hair distribution and show no signs of hair loss. The conjunctiva are pink and intact. The sclera are clear, smooth, white, and have no exudate, lesions, or foreign bodies noted. The ears are symmetrical, equal in size, and are fully formed. They don't appear to be low set. They're non-tender correct. No evidence of drainage is noted. The nose is symmetrical and proportional to other facial features. Please hold your right nostril closed. Breathe in and out. Repeat. Very good. The nares are patent. Tilt your head back for me. Tell me if anything I palpate is tender.
No.
The septum is midline and the nasal mucosa are dark pink, moist, intact, and are non-tender on palpation without significant drainage noted. Now palpate the frontal and maxillary sinuses. Is it tender?
No.
No tenderness or fullness is noted in the frontal or maxillary sinuses. Please open your mouth for me. The lips are pink and moist with no abnormal lesions noted. The gums are pink, firm, and moist with no inflammation or bleeding. The teeth are intact and clean with no signs of caries. No dental appliances were noted. Please stick out your tongue for me. Raise it. You can rest. The tongue is midline with no deviation or lesions and is smooth and raised. The floor of the mouth is also smooth and raised and free of lesions. Open your mouth wide and say "ah" for me.
Wow.
Good. Rest. The tonsils are present and intact without redness and are 1+. No exudates are present. The palate is symmetrical and the uvula rises symmetrically as the patient says "ah." Now tilt your head back for me, please. The trachea is midline. I'll now palpate the carotid arteries. Carotid pulses are 2+ bilaterally. Now auscultate for bruits. No bruits are present, and no JPDs noted either. Now palpate the thyroid. It's palpable, midline, symmetrical, smooth, rubbery, and is non-tender correct. The thyroid isthmus is midline, and no enlargement is noted. Now I'll assess the nails. Nail beds are pink, translucent, and smooth. No signs of clubbing are noted. Now I'll test for capillary refill. Very good. Good. Capillary refill is brisk on all 4 extremities. Now please take your shirt off for me. consistently pink colored, soft, and warm. Surgical scars are present on bilateral knees, but there are no suspicious piercings or lesions noted. Now analysis for edema. No edema is noted. There are tattoos noted to the left arm and chest areas. Now I'll assess the pulses. The radial pulse is 2+ out of 4 bilaterally. Brachial pulses are 2+ out of 4 bilaterally. The dorsalis pedis pulse, 2+ out of 4 bilaterally. And the posterior tibial pulse is 2+ out of 4 bilaterally. Now I'll palpate the lymph nodes. Please tell me if anywhere that I palpate is tender, okay? The preauricular, postauricular, occipital, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular lymph nodes are all non-palpable and are non-tender. Now I want you to breathe normally for me. Deep breaths. Respirations appear unlabored, with regular rhythm, rate, and depth. No retractions are noted in either the supraclavicular fossa or the intercostal spaces. The thorax is symmetrical, with no signs of barrel chest noted. And now I'll assess for a chest expansion. The thumbs move apart symmetrically while assessing for chest expansion. Now I'll auscultate the breath sounds anteriorly and posteriorly. Auscultation anteriorly reveals clear auscultation to the apexes and bases of each lobe. Auscultation posteriorly reveals clear and equal breath sounds in the right lower and left lower lobes at both the apexes and bases of each of those lobes. Now I'll assess the cardiovascular system, starting with the PMI at the midclavicular line, the 5th intercostal space. No thrills, heaves, or lifts are noted. Please lie down for me, Mr. Bullens. No signs of CVP elevation are noted. And pulsations have rapid upstroke and slower downstroke. Now auscultate the mitral area while the patient is still lying down. You can sit up now, Mr. Bullens. I'll continue auscultation with the patient sitting. S1 and S2 are noted in the aortic area, pulmonic area, Erb's point, tricuspid area, and the mitral areas, with no gallops, murmurs, or extra heart sounds noted. S1 is noted to be louder at the apex, and S2 is noted to be louder at the base. The abdomen is flat and symmetrical. There are no scars noted to the abdomen. There are shivers dry noted to the lower abdominal quadrants. Now I'll auscultate the abdomen. If you'll please lie down for me, Mr. Bullens. Bowel sounds are normal active in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. The aorta is auscultated in the epigastric region, and no bruits were heard. Now I'll percuss all four quadrants. The abdomen is supinic with some dullness heard over all four quadrants. Now I'll palpate the abdomen, the bladder, and also the femoral pulses. Is it tender anywhere?
No.
Very good. The abdomen is soft and non-tender to palpation. No masses or distensions noted. The liver is palpable below the 11th and 12th ribs with no signs of enlargement or tenderness noted. The bladder was non-palpable and was non-tender in the hypogastric region, and the femoral pulses were palpable bilaterally and are 3+. Now, Mr. Bullens, I'll ask you to please sit up for me. Now I'll palpate the kidneys. Please tell me if it's tender anywhere.
No. 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 No.
Good. The kidneys are non-palpable and no CVA tenderness is noted bilaterally. And now I'll assess the spine. Please remain sitting for me. Very good. Stand up. The spine is in alignment both standing and sitting. The muscles are symmetrical, smooth, and seem to be non-tender. Muscle mass symmetry, or the muscles are symmetrical, and the muscles are normotonic. Mr. Bullens, you can replace your shirt if you wish, but you don't have to. Now I'll assess the joints, starting with the TMJ. Open and close your mouth. Very good. The TMJ moves smoothly with an audible and palpable click noted as the mouth is open. Rotate your neck for me, please. Very good. The neck has full and active range of motion. Move your shoulders forward. Now back. Raise your arms over your head. Careful with the light. And down. The shoulders move through full range of motion. Now flex and extend your arms for me. Now hold your arms out like this. Very good. The elbows move through full and active range of motion. Now I'm going to ask you to rotate your wrists for me. The wrists have full and active range of motion. Make a fist for me. Extend your fingers fully. The metacarpophalangeal joints have full active range of motion, and the proximal and distal interphalangeal joints have full and active range of motion. Now I'm going to ask you to stand up for me and rotate your hips like this. Very good. Both hips have full active range of motion. Squat for me. Stand up. Very good. The knees appear to have full active range of motion as well. Lean to the left, to the right, touch your toes, and back up. Very good. Both the thoracic and lumbar spines appear to have full and active range of motion. Now you can sit down for me, Mr. Bullens. Rotate your ankles. Very good. Flex and extend your feet. Ankles have full and active range of motion. Curl your toes. Extend them fully. Toes have full and active range of motion. I'm going to ask you to squeeze my hands, please. Push against my hands with your feet. Very good. Muscle strength is noted to be 5 out of 5, equal bilaterally. Hand grips are also 5 out of 5 bilaterally. And foot pushes are also 5 out of 5 bilaterally. Now, Mr. Bullens, I'm going to assess the cranial nerves. Do you have any trouble with smell?
No.
Very good. Cranial nerve 1, the olfactory nerve, is intact. Now, Mr. Bullens, I'm going to assess cranial nerve 2, which is the optic nerve, by having you read the fine print on this piece of mail.
Place a sticker directly in the corner of the license plate.
Very good. Mr. Bullens was able to correctly read the line on the piece of mail. Therefore, cranial nerve number 2, the optic nerve, is intact. Now I'll assess Perla. Just look at me, please. Pupils are round, even, and react briskly to light. Therefore, cranial nerve 3, the oculomotor nerve, is intact. Now, keep your head centered and follow my pen light with your eyes. Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens are all intact. Now I'm going to assess for cranial nerve number 5, the trigeminal. Close your eyes for me. Tell me if the object I poke your face with is sharp or soft.
Sharp. Sharp. Soft. Soft.
Very good. Cranial nerve number 5, the trigeminal nerve, is intact. Now I'll assess for cranial nerve number 7. Please wrinkle your forehead for me. Raise your eyebrows. Squeeze your eyes shut. Puff up your cheeks. Smile and frown. Very good. Mr. Bullens is able to complete all those commands with strong and symmetrical movements. Therefore, cranial nerve number 7 is intact. Now, I'll whisper a sentence to Mr. Bullens for him to repeat to assess for cranial nerve 8, the acoustic nerve.
I love my kids. I love my wife.
Very good. Mr. Bullens was able to repeat the sentences I whispered to him. Therefore, cranial nerve 8 is intact. Now, I'll assess for cranial nerve 9. Have you had trouble with your taste or gag reflexes?
No.
Very good. The hypoglossal, or the glossopharyngeal nerve, is intact by report. Mr. Bullens, can you swallow for me? Do you have any trouble with that? Have you had any hoarseness lately?
No.
Very good. Open your mouth for me. Say ah.
Ah.
Very good. Cranial nerve 10, or the vagus nerve, is also intact. Push your face against my hand, please. Raise your shoulders. Very good. Cranial nerve number 11, or the spinal accessory nerve, is also intact. Now I'll assess cranial nerve number 12, the hypoglossal nerve. Stick out your tongue. Move it side to side. Very good. Repeat after me. Light.
Light.
Tight.
Tight.
Dynamite.
Dynamite.
Very good. Mr. Bullens was able to complete all these tasks, so cranial nerve number 12 is intact. Now I'll assess for cerebellar function. Mr. Bullens, touch my finger and then touch your nose until I say stop. Stop. Repeat on the other side, please. Stop. Very good. The finger to nose test is normal with well-coordinated movements noted. Now slide your heel down your shin for me. Very good. Repeat. Very good. The heel shin test is also normal with no normal movements noted bilaterally. Please stand with your feet together. As close as you can get
I'm
them.
afraid of the dark too.
Close your eyes.
Mm-hmm. By the way, I'm Kermit the Frog. I'm Dot. You're a dragon named Dot?
Well, nobody calls me by my full name, Bella, daughter of Sweater.
The Romberg test is negative.
She's angry.
Now I'm going to ask you to hold your arms out.
I was on an adventure with my friends.
Close your eyes.
We got separated, and the way they went is really, really dark.
Oh no.
Very good. The pronator drift test is
I don't
negative.
feel so scared standing
Now
here talking
walk
to you.
from here over there.
Together.
You mean if you get scared, I'll
Very good.
you?
The gait is heel toe and normal.
I'll be there to help you. What do you think?
And that completes our assessment, Mr. Mullins. Thank
I
you.
think that's